today in advance, so we're ready to jump right in. And if we have time for questions at the end, we'll do that.
Wonderful. Well, thank you so much for having me today. I'm Amanda Peltz. I'm the Executive Director of Nurses for Newborns. I'm going green, so I have my notes on my screen here. Our mission at Nurses for Newborns is to prevent infant mortality, child abuse, and neglect. We do that by sending registered nurses into the home of what the literature says is the most at-risk population for infant mortality, child abuse, and neglect. So that is medically fragile infants, babies that have spent any time in the NICU, have any medical concerns of any sort, moms with medical, mental health, and substance abuse concerns. We all know that the substance abuse concerns is a growing population, and teen moms that lack support. So as our nurses are going into the home, they're teaching safe sleep, they're teaching CPR, they're doing nurturing parenting curriculum, they're using 28 substantiated clinical care guidelines, that is our model of care, to do assessments of the health and wellness of mom and baby and the safety of the home environment. So by doing that, we're not only just serving that mom and that infant, but we're serving the entire family, providing that nurturing parenting curriculum that's going to help with other children that are either already in that household or will be in that household in the future. So we take referrals prenatally or postnatally. As long as we receive a referral before the child turns 1, we can stay until the child turns 2. We are not often needed that long. In fact, our average number of visits is between 4 and 5 visits per family, really depending on what they need, what their level, their acuity, how much do they need from us. And we can start going in weekly, bi-weekly, monthly. It really just depends on what that family needs. So what we are specifically requesting today is $50,000 for our Nashville services. That would fund approximately 140 visits to approximately 30 families in FY20. Davidson County, Nashville is our largest service area by far. We've seen a decrease in hospital support over the last year just because the hospitals are having such an increase in their level of need from their patients, kind of taking a drain on their resources they have available for community support. We're just seeing that change. So we are projecting a decrease in our services in FY20 without this support. So on average, it only takes us $1,500 to $2,000 to serve a family, and it is completely free to our clients. So I really want to focus on how that relates to your all's goal to create a more equitable Nashville. I always think of that image, I know we all know it, standing in front of the fence, the equal with the 3 footstools versus equitable, right? The different heights of those stools. So at Nurses for Newborns, we are literally and figuratively meeting the client where they are. So we are eliminating transportation barriers by going to them. We are eliminating language barriers with our language in-person, female, medically certified interpreters. And we are eliminating information and access barriers. So, even as simple as people not realizing that watering down formula can cause seizures and can be very dangerous to an infant. That can be a form of child neglect. When it's unintentional, we want to make sure that Nurses for Newborns, that we're able to provide that education so mom knows exactly how to measure formula. Postpartum depression occurs in 1 in 7 women. We are often the first to see it in these moms. It doesn't always happen immediately for a pediatrician or an OB to catch it. So we're in the home, we're doing depression screenings, catching that postpartum depression, which has a significant impact on the bonding between mom and infant and can have lifelong impacts. That can also be a form of unintentional neglect. So the work that we're doing, and you have our application, we're focused on immunizations, medical home, preventing household safety injuries, safe sleep, not only teaching, but that safe sleep is being practiced, that families aren't using the ER as their medical home, things of that nature. So we're helping families become more economically self-sufficient. We're keeping families and communities safe, and there is a large saving for taxpayers. Home visiting on average can save taxpayers $4 for every dollar invested. So this $50,000 investment could save the city $200,000. over the course of those children's lifetimes. So we are helping the caregivers with whatever their need, mitigating the effects of the ACEs that they experienced in their childhood, preventing ACEs for their children, making sure that the child itself is on track developmentally and with their health, making referrals to TEIS and other resources as needed, because every parent in Nashville deserves to celebrate their child's first birthday. And unfortunately, 25% of the deaths in Tennessee of infants before they turn 1 is preventable sleep-related causes. So Nurses for Newborns is saving lives through the safe sleep education. We provide pack and plays when there isn't a safe place for that infant to sleep, making sure that all of our infants are safe and make it to their first birthday. Let's see. That was, that kind of hits the highlights. Any questions, anything you'd like me to touch on more specifically?
Do you currently, or have you in the past, I may be remembering this incorrectly, did you have some type of relationship with our Department of Health?
Yes, we
And
had
a separate contact? Yeah, so
Yes.
can you talk about what you're doing on that side of it?
Yes, we had a promising approach grant through the Department of Health. McV, the National Maternal Infant Early Childhood Home Visiting Program, deems certain home visiting models evidence-based. Through the Department of Health, we were awarded a promising approach grant because they looked at our model and said, you don't have the research yet to prove that you're evidence-based, but looking at your model and your outcomes internally, we believe that you are a promising home visiting approach. So we received a 3-year grant. We conducted our research here in Tennessee. We have a home office in St. Louis, Missouri. They are wrapping up their research now, and then we're presenting our findings together to HRSA and McV to be considered to be an evidence-based model for home visiting. So in Tennessee, we did find that infants served by Nurses for Newborns are 3 times more likely to triple their birth weight by their first birthday than infants not seen by us. And an infant's and child's weight is a leading indicator of their health. So that is a very strong kind of health outcome for those infants. So right now we're waiting on Missouri's research.
I just thought that that was a really important thing for you to mention in terms of
Thank you.
outcomes and evidence-based
When
data.
will that research be available?
So we believe that they will have their findings this summer or fall.
How do you find the families?
Mostly through hospitals and community providers, pediatricians, OBs.
And do they know you and they just refer out, or?
That's correct. So we just, we have a direct relationship with caseworkers, the physicians in the community, to make sure they know who to refer to us and who we can serve. And so we get those referrals from providers. We contact the family, explain our services, and they can choose to accept or not accept.
What's your annual operating budget?
Right around $700,000.
How many families did you serve last year?
Last year we served 328, I believe.
Do you find yourself in like a certain part of town or with a certain demographic, or?
So a growing demographic for us is moms that are struggling with substance abuse, not just opioids, but that is also a harder population for us to engage in services. There's a lot of distrust in the system, and so we are working very hard to overcome that. So although that is a growing population in terms of referrals, it's not growing as heavily in terms of service because they don't want us to come. So that's something that we're really focused on this year. How can we better engage those moms if we met them in the hospital before they left the hospital, and our nurse could introduce herself, start building that relationship? What kind of impact would that have? So we're working with local hospitals on being able to do that, permission to come in to the floor.
Okay. Anything else? It's good.
Thank you.
Okay, great.
It's
Thank you
terrific.
so much.
It's
Yeah.
terrific. Thank you.
Appreciate your time.
You're welcome.
Okay,
Hope you get to go outside today.